welcome back, guys. This is Vibas. I'm Shankri, joined by Sharita, and we are speaking about fertility issues with Dr. Shara. Now, right before we went to the commercial break, you were sharing with us the causes of infertility, also how conception happens. Now, recently I've read in some statistics from the National Center for Health Statistics, and they suggest that younger and younger women are finding it difficult to get pregnant. And in yesteryears, this used to be an issue of older women. What do you think? Why do you think this happens?
Well, I'm not really sure what the details of the study showed, but we know that women are now delaying childbearing, so age may be a factor. In this particular case, you're saying younger and younger women are getting less fertile, is that right? So one of the main reasons may be because of with regards to lifestyle. Okay, we're eating more these days, we're getting fatter. 1/3 of the worldwide, we have overweight people. Sorry, about a half are nearly overweight in the Western world. About a third are obese. Obesity plays a big part in both male and female fertility. You know, it affects your menstruation, it affects your ovulation, it affects your sperm quality, and it affects erectile problems in men. So I think it's all lifestyle factors, poor diet, lack of exercise, stress. Stress, and then of course, you know, climbing the career ladder and career advancement. That of course delays childbearing. So I think that's one of the biggest reasons. I think the second other reason could be maybe due to pelvic infections causing tubal damage. That could be another reason why tubal factor may play a bigger part in impaired or reduced fertility amongst women and men.
Sharita, I wish to bust a myth right here, because they say when, you know, especially using technology, like men having their laptops too long on their laps could cause infertility. How true is this?
That's right. I've read some reports on mobile phones being in the pocket. That can affect semen parameters. When we're looking at sperm, we're looking at how fast they swim, how many sperm there are, and whether they look normal or not. So that can affect the semen parameters. It can affect the sperm quality and function. Laptops, mobile phones, of course, environmental pollutants.
Okay, so this is true then. Laptops can affect.
Well, there have been reports. They haven't been actually confirmed reports. There haven't been no randomized control studies have actually been conducted. Large studies that haven't been conducted. These are, you know, individual reports.
Of course.
But why take the risk?
Another myth though is using the pill can alter your hormones and play a role in infertility.
That is another myth, I think. Okay, the pill is used for many things in gynecology. We use the pill for painful periods. We use the pill for irregular periods. We use the pill for birth control, all right? If the pill was used for birth control in the first instance, then it should not affect your fertility. It's been used should not affect your If the birth control pill was used for underlying problems like, say, polycystic ovaries, and this patient may then present with irregular periods, and the reason why the pill was put on was to give regular cycles, then it's the polycystic ovaries that are causing the fertility problems, not the pill.
But I think what Sharita is trying to say here is that with a long-term use of pills, will it cause infertility?
That's what I heard famously on the Kardashians.
No, long-term use of the pill does not cause infertility.
So we've busted a myth right now. Two myths.
Wow, good job, girl. All right.
Okay, so you touched earlier that lifestyle factors affect fertility. What can we do to prevent infertility?
Well, I mean, the thing is, everything in moderation. Diet, a well-balanced diet. For the female or the woman, folic acid preconceptually is advised. That at least 3 to 6 months prior to trying for a baby. You know, there's loads of information about what the best diet is. We don't really know what's really the best. I think the best is a balanced diet with you know, a portion of green vegetables and quarter portion of complex carbohydrates and a quarter portion of proteins. Exercise 3 to 4 times a week of at least 30 to 45 minutes per session. A structured weight loss program is advocated. Join the gym, get a personal instructor. a 5% reduction in weight improves your ovulation tremendously.
Wow.
Yeah, so, you know, if that little bit of weight gain can affect your menstrual cycles and your ovulation tremendously, and that 5% loss can improve it. And it's the same for the man too. You know, it prevents against, obviously, things like diabetes and high blood pressure, which can affect your fertility, but in fact, it improves erectile dysfunction if you're exercising constantly.
Right.
Of course, the big no's and big taboos like no smoking, no alcohol, no
Yes.
excessive drinking, you know, no excessive caffeine intake.
Drug abuse.
Drug abuse, yeah, obviously drug abuse, yeah. That's a different segment of the population.
Yes.
We don't see that often, but obviously drug abuse in terms of hard drugs,
yes.
cocaine and marijuana and things like that.
Yeah.
Yeah.
That was some really good advice, Doctor, on helping people out there to prepare for a healthy conception. But what could they do to protect their body from becoming infertile?
Well, I mean, a balanced exercise, diet, good nutrition, stress reduction. The other thing I haven't spoken to you about is stress reduction. Yoga is fantastic.
Like we just saw just
Yeah,
now.
acupuncture, you know, going to the gym, cycling, swimming, all these things that reduce stress, hydrotherapy, whatever.
Yeah.
Whatever works for you, try it.
So here's a question. At what point should couples start worrying about seeking medical help if they've been trying and not succeeding in
Yeah, that's a very good
conceiving?
question. Depends on your age. If you're younger, then you could wait 1 to 2 years. That's provided, you know, you're trying at least 3 to 4 times per week, unprotected, no barrier methods, no hormonal methods. Within that 1 to 2 years, if things don't happen, then you should seek help. If you're above the age of 35 and you're having risk factors, for example, like polycystic ovaries, where you have irregular cycles, or endometriosis, which has been proven in the past, then you should go earlier, within 6 months. The chances of natural conception in a young, healthy person, like a woman, is about 80% in the first 1 year of trying. And after 2 years, it goes up to about 95%. Right? So give yourself 1 to 2 years. If you're young and healthy, you're not overweight, you're having regular cycles, you're not having any menstrual problems, and your sperm parameters are all normal. And then, you know, go for investigation after that.
Right. All right, Doctor, you've mentioned that things like polycystic ovarian disease and also endometriosis causes could be linked with infertility.
Yes.
But are there perhaps some other medical conditions, serious medical conditions, that can be tied up with fertility
so it all
issues?
comes back to the general health and well-being thing I was talking to you about. It's a holistic approach, because if you're healthy and well and you're not overweight, you're going to prevent things like hypertension and diabetes. Of course, these are general medical conditions that we are talking about, but not so much per se in terms of causes of fertility problems. The big ones are things like, we definitely know it's PCOS, polycystic ovaries, endometriosis, maybe a fibroid in the wrong place, and things like that, and pelvic infection causing tubal damage and things like that.
All right. And there you have it, ladies and gentlemen. Really good advices from Dr. Sharath. And,
Yes, it has been. It's, you know, it's all about healthy living and living healthy. And
definitely we tackled the fertility issues with you, Doctor. Thank you so much.